Hi, this is Mary Collins with Insect Shield, and I am here with Dorothy Leland, who is the president of LymeDisease.org and the author of When Your Child Has Lyme Disease. Welcome, Dorothy.
Thank you.
Okay, well, basically, LymeDisease.org is a great partner with Insect Shield. You promote our product. We have you as a corporate partner. We think you all do great work, but we'd love to hear more about the values of or the mission of LymeDisease.org, what you all do, because it's a bit different to a lot of the other Lyme disease groups out there. But before we get to that, I would just love some background on you and how you ended up getting involved in the Lyme disease community, and let you kind of give that background, please.
Okay, well, like a lot of people in the Lyme community, I was recruited by a tick, but it wasn't a tick that was on me. It was apparently on my daughter, though we never saw it on our daughter, so we didn't know that. My daughter, this was back in 2005. She suddenly, practically overnight, became quite impaired. She couldn't walk. Everything hurt. Her body completely hurt, and her ankle hurt, and her necks hurt, and her legs hurt. And we finally had to get a wheelchair just to get her any place, just to even get her to the doctor. And the doctors couldn't figure out what it was. And somebody told me, one of my neighbors said, well, have you ever checked for Lyme disease? Which I had only been peripherally aware of that as a thing. And eventually we asked doctors of that, and they were like, oh, no, that's not Lyme disease. It's not Lyme disease. And, but they couldn't find out what was wrong. And so, which unfortunately happens to a lot of people. If the doctors can't find out something that's wrong, the determination is there's nothing wrong. And so obviously, this 13-year-old girl who was in pain all the time and couldn't play soccer and climb trees and do all of those things that she wanted to do, they said, oh, well, she was faking it for a test. And when you're in the middle of that, I mean, that's just, what? That's crazy. Yeah. What is this? And it was a long involved story, but eventually we found out about the Lyme community. This was back in 2005. Facebook wasn't a thing yet. Twitter wasn't a thing yet. But there were some online chat groups and things like that. And it turned out it was like this whole other world that wasn't, it was almost like this underground thing. And there were certain doctors that could help you and certain treatments you might take. And so eventually we got that way. And she did get diagnosed with Lyme disease and Bartonella and Babesia.
And how long did it take for her the diagnosis for you to find out?
To get diagnosed? It was about 9 months, which is really in the Lyme isn't very long. Yeah. There's people that go 3 or 4 years or even longer. But it was, anyway, so we found out that it was Lyme disease, and we just got in this alternative universe. And she did a lot of different treatments, and eventually she got better. And she's 31 years old now. Actually, maybe she's 32. and she basically lost her teenage years.
Yeah.
In many ways, but she has recovered and gone on to, live a good life. And I got at about the same time that when I was in the midst of all of that, I was like, as soon as I get out of here, I'm going to change this. I'm going to do something to change this. And I think so people feel that same way, that they feel like, they feel so abused by the system, and they want to fix it.
Right.
And so that's where that's where Lyme advocacy comes from. And it is either people that have been sick themselves or people that have had a close family member, friend, partner, somebody that they're.
Oops.
And that's the spark that says you want to try to change things. And so LymeDisease.org has been a patient advocacy organization for more than 30 years. It's gone through a couple of different name changes. At the time that I first came across it, it was called the California Lyme Disease Association. And they, as an organization, were very helpful to me. They had an online group, and there was a lady that I used to talk to on the phone that steered me towards places. They gave me resources, and they published a magazine called the Lyme Times, which had useful information. And so I kind of gravitated towards them when I got to a point where things were better and I wanted to try to fix this. And so I got involved with that. One of the things that really struck me when I was just in the worst of all this was that there wasn't much information easily available. And even the group that I am now president of had a website, but it didn't have very much information on it. And groups didn't have much information. That that aspect of social media hadn't come to fruition yet. And I wanted to have a place where somebody could go and get information. And so when I started working with the organization, I remember talking with Lorraine Johnson, who is the CEO, and said, I wanted there to be a news hub. I wanted people to have a place that they could go. And that was when blogging was a new thing. It was like, and the Huffington Post had just started, and they had all of these things called blogs. It was like, well, what if we do a blog? And so we did. And I would a blog called Touched by Lyme, and Lorraine would write a blog called Lyme Policy Walk. And then eventually we started getting guest blogs from people, and we would do news items that came from, maybe the Washington Post had a story about Lyme disease. We would have something about that. And so there was a place that you could go and you could find information about Lyme disease. And so that, in terms of what I have done, that was my vision. And so
it's come to fruition. Yeah.
It really has. Now there's a lot of other sources of information now, and that's good. But partly there's so much information. See, when I was looking for stuff, there wasn't anything. And now you go and it's like this waterfall of stuff that falls on you, and you've got to try to figure it out. So I view that one of the things that we do is we curate news, that we say, okay, here's something that we want to bring to your attention, and here's something else that we want to bring to your attention, and have it. So just like, the editor of a newspaper says, okay, we'll put this on the first page and we'll do this on the second page. You decide, you choose, because otherwise you just get dumped. It's just an information dump, and nobody can figure out what they're doing.
Yeah, and it seems like I'm saying there seems like with Lyme disease too, there's so many some things work for some people and some things don't work for other people. So there's someone say, hey, this is this new treatment, it worked. I'm so much better. And then somebody try it and it doesn't work. So you have to be sensitive to kind of the information that you give out as well.
Absolutely. Absolutely. And we can't tell somebody, we're not their doctors, and we can't say, this is a treatment you should do, but we can provide information. And so I've often said, that a lot of diseases, you get them and you go to the doctor and the doctor says, here, take this, and you're done. But here you have to sort of go to graduate school, the equivalent of going to graduate school. You have to read all kinds of things and keep up with them to know what to do. One of for many years, I was the leader of a support group in Sacramento. I don't do that now because I do other things. But I did that for about 8 years. And that was very educational to me because I talked to so many people in so many different situations. And I can remember a number of times somebody would say, okay, your daughter was sick and now she's better. Give me a list of everything that she did and I'll go and do those. Everything she took, everything, whatever. And it's like, it doesn't work that way. It doesn't work that way.
Yeah.
You could take a list of everything that we did. Well, for starters, some of the things that we did didn't work.
Nice.
It's a process of focusing on what ultimately works. And so everybody is different. There can be, it's whatever what you started out with genetically and what you were exposed to and what co-infections you have and were you exposed to chemicals, toxic chemicals. There's so many things that in fact, there are people that are in the same family that have gotten bitten by ticks and have gotten sick. There have been more than you'd care to know. Everybody, the people that I've met, everybody in the family has Lyme disease. They all go to the same doctor and they don't necessarily all have the same treatment.
Right.
Because all of those things that I was saying, that just there are different factors and it can affect people so differently. It's that, particularly just thinking about children, for some children, it's that their knees hurt. For other children, it's that they have trouble learning how to read.
Mm-hmm.
And that can both be caused by tick-borne disease.
Right.
And so it can behavioral problems can be triggered by, things that come from tick-borne disease. And so it's in no way a one size fits all.
Right. Yeah, I mean, I guess. Okay. it's because I've been it's some of the stories are just heartbreaking. And I can only imagine, and I don't know, but like how many people too are out there that are not diagnosed and, are going through and, I'm sure that the mental, the psychological, outcomes and feelings of, not being listened to or being told, what you're feeling is not true because we don't see anything wrong with you. You look great. I've heard that a lot of people saying, well, everyone says I look great on the outside, but my insides are hurting. So that part of it has to just be really hard to go through. And people that maybe don't have, a mother like you, that's like, we're going to fight this. What's happening here? Let's together as a family, like we're going to get this sorted out. And then even, I guess then speaking on that side, but then going to the doctors and doctors saying this doesn't exist or insurance saying we don't cover this. I mean, the expense for some people just has to be, astronomical to manage that. So is that, I think that's something you all work on too, is how do we get kind of more on that back end, on the logistical side, like to go to a doctor that is going to, is a Lyme literate doctor and that insurances are going to cover? Like, is that something you all work with as well to try to get those communities on board to supporting people?
Well, one of the things that LymeDisease.org does is it's eventually folded into the My Lyme Data program, but even before we started that program.
But you have to, you need to tell us about that too, because we didn't cover that yet.
Okay. Well, but I was going to say, we do surveys. One of the things that we do surveys started with patient surveys, but one of the things that we did this year is we did a doctor survey, and it was a survey of doctors who treat long-term Lyme disease. There's not very many of them in the country. And we asked the doctors what stands in the way of their trying to help people that have Lyme disease. And I mean, there's a long list, but one of the things is that there are just so few doctors that have the experience and the know-how to even recognize that it's a tick-borne infection and what to do about it, that when we lived in Northern California, and so when my daughter got sick in '05 and we eventually started looking for Lyme doctors, we're about 2 hours away from San Francisco.
Mhm.
And there were a number of them in the Bay Area in San Francisco. But there are whole parts of the country where there isn't anybody in the whole state.
Mhm.
And while we were in that doctor's office in the San Francisco Bay Area, anytime you went, you'd strike up a conversation with somebody in the waiting room and that, oh, they had gotten the taxi and brought them from the airport
Wow.
to their doctor's appointment. And they had flown from Georgia
Right.
or Singapore. We had people from all over the world in our doctor's office waiting room. And so it really, you had to wait.
Right.
You had to pay out of pocket.
Yeah.
You had to, and insurance has changed a lot in just the nature of insurance has changed a lot in the last, 15 years. And so at the time, there were some things like the doctor's appointments weren't covered by our personal insurance, but some of the testing was, or some of the treatments were. But it was a whole, and that was, we were lucky. There were a lot of people who didn't even have that.
Right.
And it's just, and that is getting, as I say, insurance is really changing a lot. And things that used to be covered by insurance aren't anymore.
Mm.
And it's just, you help anybody in that situation needs help on a lot of different levels.
Right.
And partly they need the doctor that's, paying attention to them and recognize what's wrong with them and has some idea of how to fix it. And when those are very rare, and then there are insurance challenges,
right.
And then there are, there's just a lot more. You mentioned that I wrote a book, When Your Child Has Lyme Disease. I actually co-wrote that with somebody who's a Lyme literate psychotherapist named Sandy Berenbaum, and she's on the East Coast and I was on the West Coast. And we were on the phone and the computer and everything, and we wrote this book together. But one of the things that we were trying to deal with was how it impacted the family and the family dynamics and what happens when you have a sick child.
Right.
But then there's all this other stuff, there's all this other stuff on top of it. But anyway, I'm drifting off here.
No, but is there a test? Because this is where I'm is there a test that, I know now because it's IGeneX, is that the company that does the testing? No, is there IGeneX? Is there a test that is definitive that, because I know that's been one thing I read, sometimes people get or the test in the beginning doesn't show it, but maybe 3 months later, that's going to be such a struggle too if you don't have a test, or it's 2 years later you test positive, but you knew you got bit 2 years ago and that's when you started feeling poorly. So what's with the testing?
The testing, there's a lot of there's a lot of things coming down the pipeline for testing, but they're not there yet.
Mm-hmm.
And it's just testing has been problematic because basically most of the testing looks for antibodies to Lyme disease, not for Lyme disease itself. And there's scientific reasons why they do that.
Okay.
But the fact of the matter is that, not everybody, if you're too sick with Lyme disease, your body is too weak to produce antibodies. So the test says, oh, good news, you don't have it.
Right.
And, but there is a lot of movement happening with that. The Health and Human Services Department has actually partnered with the Cohen Foundation to do I can't think of the word right now, but it's a challenge, like a test. It's like for companies, there's a money.
Okay, right, sure. Yeah, right. Like they put out a call for ideas, or yes, like
right. And so they just went to the first. They fixed and it's to develop a new test for Lyme disease, an early test for Lyme disease.
Because that seems it could be to the point. If we can be in 5-10 years, if you're feeling it would be an easy, like, you go in, even if you don't know if you were bit by a tick, but it's standard protocol for someone comes in, they're having these types of symptoms. Oh, check off the Lyme disease box when we send them out for the blood work. And then, I'm sure that would, that's probably the dream, because then everyone could know.
Yeah. I mean, why, and the thing is, I think most, people that aren't in the middle of this think, oh, well, you just get tested.
Right.
You just get tested. Do you have it or not? And the fact of the matter is that there has not been there. Now, there are tests that from Igenix and other companies that can show information that it's important to doctors, that doctors understand what that is.
Right.
If you just take a test, it isn't just, you're pregnant or you're not pregnant.
Right.
It's not, it's not a toggle switch. And Lyme disease is such a complex organism, and it can affect people's bodies in such different ways that there just isn't, it just isn't.
And that's the thing. It's also too, because it's Lyme disease, but then there's also all the co-infections. Like, and I think people don't realize, they think it's Lyme or it's nothing, but the more there's all these there's so many different infections you can have with Lyme. And it seems like most people have more than one. And it's like kind of Lyme is the umbrella. Is that the good way to describe it?
Oh, I think so. Some people, some doctors, authors of books will refer to it as like Lyme complex or Lyme plus, which is that it's Lyme disease and whatever other nasty stuff is in there with it. And it's, it's one of those things that, there's different strains of Lyme disease.
Right.
And so and there's some, there's strains that are more common in Europe and others that are over here. And they react differently in tests in different parts of the country. Mm-hmm. And, the sort of, for a long time, one of the standard tests was really based on the kind of disease you'd get if you were bitten in New York.
Right.
And so in California, that's maybe why a lot of people would test negative.
Right.
There's also things that there's, relapsing fever and other kinds of things that have similar symptoms to Lyme disease, and are carried by ticks, but they're not technically Borrelia burgdorferi. Okay. And so they don't show up in these tests.
Right.
And it's problematic. And the tests, as I say, the tests can be useful, but it isn't, like, a lot of times I get contacted from people all over the world. And sometimes my heart goes out to them, but they'll say, just tell me what test my doctor should order.
Right.
And it isn't that easy. It isn't that there's not a slam dunk. If you just got this test, and then if they test positive, just tell me what antibiotic I should take.
Right.
And it is so complex.
Yeah.
That it just isn't, that it isn't a slam dunk.
Yeah. Yeah. No, it's a chronic. Yeah. And it's the chronic, the part of it. And see, and just the different, so many different symptoms, ailments that people have. Like you said, depending on their genetics and what's going on in their life, and maybe some other underlying health things. And, it's shocking. And then it's amazing though, but then you can recover. I mean, look at your daughter now, but does she have to be careful? I mean, if she was bitten by a tick again, could it be like kind of reactivated or anything of that nature?
Or you could get a different strain of it. It's not something like if you got over it, never get it again.
Right.
You could get it again. Also, there are reports of people getting COVID, and then it reactivates all this other stuff. And so, reactivates Lyme, reactivates Epstein-Barr.
Mm.
A lot of people that have Lyme disease also have Epstein-Barr, which, did they get it from the tick? Did they get it that the Lyme disease lowered their defenses and they got it from some other way? It's like, who knows? They have it.
Right.
A lot of people with Lyme disease have Epstein-Barr. And, some authorities argue about whether Bartonella is carried by tick or not. And it's like, yes, they say, well, Bartonella is in ticks, but we haven't been able to prove that they transmit it. But the fact of the matter is a lot of people that have Lyme disease also have Bartonella. Right. And I was heartened at a recent meeting and watched of the Tick-Borne Disease Working Group where somebody said something, and Dr. Ben Beard of the CDC said, because the CDC is always like, oh, no, it's not tick-borne, it's not Bartonella. And he said, well, we don't know if it's tick-borne or not, but we're willing to accept the fact that a lot of people with Lyme have Bartonella. And I thought, oh, hallelujah.
Right.
But I was contacted by a parent recently that her son had been bitten by a tick and got real sick. They live in California. He was back east going to college. And he had tested for Lyme disease and he didn't have Lyme disease, but he had all these various symptoms. And so when he came home for Christmas, this was actually maybe a year ago. And then when he came home for Christmas, they arranged for him to go to one of the Lyme doctors in the Bay Area who tested him for a lot of different things. And he never tested positive for Lyme, even with a lot of things, but he had 3 different strains of Bartonella, which Bartonella, is awful. It's horrible, and it can cause all kinds of stuff, including mental, psychosis.
Wow.
And so it's just, there's a lot of stuff out there, and it isn't terribly helpful when somebody is feeling sick and you go in, you say, I was bitten by a tick and now I feel horrible. And then they say, good news, you don't have Lyme disease.
Right. And then you're like, well, I still feel horrible. So what's that doing for me?
Because of their testing,
right.
And so, and you probably do have Lyme, you may very well have Lyme disease, as well as any of these other things. So it's really complex, and doctors, my understanding is in medical school, they don't get that they don't get training in that.
Right.
And that has to change. And there are, Lyme organizations that are working to change that on different fronts. But there's a lot of entrenched interests, and it's hard to change. One man that I talked to, who was a retired professor from, I believe it was UCLA, said that in their medical school, they got doctors in training, got 1 hour devoted to vector-borne diseases. Right. So, that includes mosquitoes and other stuff.
There's a lot. Oh my gosh, yeah.
Yeah. And so in all of medical school, and then you would think, well, then infectious disease doctors, wouldn't they get more in their training? Right. And the fact of the matter is the Infectious Diseases Society of America has been, has put up huge roadblocks to anybody learning or getting treated for Lyme disease. And
well, then I guess, but so then what you all would like, actually, maybe then that can subject to like the My Lyme data, because you're trying to get data about people with Lyme disease, and then that could be used to say to these institutions, hey, there's a very large community of people that have this sickness, and at least you can have some science. Like no one had studied until you really started this My Lyme data. You could kind of tell us, what the idea behind that was.
We started it in 2015, and the idea, it's a patient registry. And so if you live in the United States and you have been clinically diagnosed by a doctor as having Lyme disease, then you can You can be part of the study. And you put it's basically a bunch of surveys.
Yeah.
And you start out with initial background about, do you know, were you bitten by a tick to your knowledge? How long ago? When was it? When did you start having symptoms? How many doctors, how many doctors did you have to see before you were diagnosed with Lyme disease? And then what kinds of treatments have you had? So people do an initial interview, such as it is on the questionnaire, and then they get an email every 6 months saying, will you update it? And so it's like, have you had a change of, symptoms? Have you gotten better? Have you gotten worse? Have you done this treatment? Did it help? All of that kind of information has just never been collected about Lyme disease before. Right. When there's like heart disease and various kinds of cancer, there's been tons of studies like that. And so one of the things we do is to work with researchers that are trying to solve the conundrum of Lyme disease. Right. And it's very helpful for them for researchers to have this kind of information.
Sure. Yeah.
And so one of the things that the fact is this is self-reported. And so it tends to be people who are still sick. If somebody is bitter and is going on living their life, they're less inclined to come and do this kind of. But we're very interested in them too. We have some people that consider themselves well, including my daughter, that are in this program. But in 2023, we're going to do a push to get more people who are well to share their experience of what helped them get well. Right. And that's interesting information for researchers and just for people, other people to say, what helped. Right. And so there are various questions that go through that divide people into categories. And so some people consider themselves well, and other people, they don't think they're all the way there yet, but they've substantially improved. Right. Right. And then there's people that still feel very, very sick. Yeah. And so there can be, and it is interesting to find out what works, what helps. Right. And so we have a new study that's going to come out about, excuse me, that I can't really give any detail about, except that it has to do with the differences between men and women and how they respond to Lyme. And there are major differences.
Interesting.
And so that's interesting information. And that's something that they look at in a lot of different things now that, for years, apparently all of the research on heart attacks was only done on men. And so they didn't really know whether that applied to women or not, but that was what they did. And so now they're starting to broaden those things out, that they are, there are some things that, just biologically are different between, men and women. And so how does that affect with Lyme disease? Right. And so those are the kinds of things that we are looking for. Right. And we have had, I believe it's 5 articles that have been written in peer-reviewed scientific journals based on information from my Lyme data. And that doesn't count the new one. Right. That's coming. Yeah. And so it increases the knowledge base of Lyme disease. And so it's, so we're working on, on a lot of different levels. But also I think you mentioned somewhere legislatively that when we talk to policymakers, a lot more effective if you can give them some figures and say, this many people, your constituents, or or, you know, not just legislators, but policymakers, people that work for the Department of Health and Human
Sure.
Services
Right.
and
Right.
the CDC and things, where you can point out that this is the experience of this group of people, and it
Right.
just makes it just gives something. It gives you evidence. It gives
Right.
you something to work.
Right.
So
Now, is there something then
that's-
too that people with people that have had Lyme disease can do that? What about people that do not have it but want to like help, you know, the caregiver, the mother, the father, the sister, the friend? Are there things that people can do just to, you know, help the cause as well, that people that aren't like themselves afflicted with chronic Lyme?
Yeah, well, they can't join
Right.
my Lyme data,
Right.
except in one instance, if a person with Lyme disease has died for any reason, their family member can fill out some information for them to be part of the deceased,
Right.
you know, database.
Right.
And it doesn't, they have to, I mean, they could have died in a car accident, you
Right,
know,
okay.
or something. I mean, it doesn't have to be they died of Lyme disease.
Right.
But that's another thing that's hard. You know, Lyme can cause problems with your heart, and somebody can die from a heart attack, and the death certificate says died of a heart attack.
Right.
And doesn't necessarily say Lyme disease.
Right. Sure.
You know, so there are, that's those kinds of things. There have been, you know, different groups through the years have tried keeping lists of people that have died from Lyme disease, but it's problematic. And as I say, it's problematic. There's a woman that I'm aware of that has been, you know, her husband had suffered from Lyme disease and Lyme-related problems for years and years and years, and then he died. And she tried to get Lyme listed at least as a secondary, and on a death certificate, they have the primary thing, and then they have secondary things. And she couldn't get them to list it.
Wow. Okay.
And she was, you know, this was a couple of years ago, and I don't know if there's been an update, but at that time, she thought they would not put that down. And so when government agencies like the CDC periodically go and they do studies where they look at death certificate data, it's all online, and they can say there was something, you know, fairly recent where they said in these certain states that absolutely nobody had died from Lyme disease. Well, if you don't put it on the death certificate, they can't get it. And so it's just, it's complex.
Yeah.
It's complex.
Yeah.
And how do you prove, you know, how do you prove? And so, but what we do in the decedents registry is that people can give that kind of information. And so we can collect that. I don't think we have a huge number in that. I don't know offhand. But so that's the way somebody that doesn't themselves have Lyme disease can participate in the registry. In terms of things relative to Lyme disease, I would say if anybody is close to somebody that is suffering from this kind of stuff, as I mentioned earlier, you need information. And so LymeDisease.org provides a lot of information. We have a free weekly newsletter. We have blogs.
I get it. It has lots of good information. Yes.
Okay. And so that's something that somebody can do just to be aware of what's going on. Then there are various things. There's something that is sponsored by another group, but we participate in it. It's called the Lyme Fly-In, and it's to lobby Congress for Lyme-related funding. And it's sponsored by a group called the Center for Lyme Action. And there were the very first time when they did it was early 2020. And that was the last time I was on an airplane for a really long time. Yeah. It was like February of 2020. And then we went, a group of us went around and we talked to our various Congress people and whatever. And it was, I enjoyed it. I thought it was fun. And then, but since then, what we have done, what the group has done is that it's done via Zoom. And so you have a group of you from your area will meet, usually not with the legislator themselves, usually with a staff member, but then we'll talk about, they have information and everything. And that's coming up. That'll be in February.
Okay.
And you can find out information on our website, because we put things about that, but also Center for Lyme Action.
Okay.
And anyway, and one thing that happened by now, we've done it 2 years. Yeah, 20 was in person, 21 and 22 were via Zoom. And the fact of the matter is a lot more people could participate.
Sure. Right.
Everybody can, there's lots of people that can't fly to Washington, but they participated with Zoom. And I think they had almost every state represented, and many people in many states. Of course, I'm in California. We've got lots of representatives.
Sure. Yes.
So lots of people for that. And that is something that if you have an internet connection, you can participate in that. And then there used to be a lot of things like Lyme walks and things like that in various parts of the country. And there's still some of that, but there's less of it since the pandemic, and less of those in-person kinds of things and more Zoom type things. But I would say that in terms of one getting involved in changing things, one of the best things that you could do at the beginning is to just educate yourself.
Right.
And a good way to do that is to start with our weekly newsletter.
Yeah.
So you can go to our website, LymeDisease.org, and there's a thing right at the top, sign up for the newsletter, and you put your email in there.
And actually, too, as a partner, I know, because you have it listed on your website a lot, and that's where with Insect Shield, because in our world, we have something that can help protect people from even getting the tick bite. So we are a great partner, and actually we give proceeds back to any sales that come through your website, go back to you all to help you all continue the work that you're doing. So, so I have one more question, and then we can wrap up, because it's what you all do. It's really amazing. And the more I've been learning about Lyme disease, just some of the story, it's just it's heartbreaking. But then to know that, if people just knew, okay, I can go to this website. I think even now you watch a local newscast and it's summer and they do their little tick. Oh, be careful of ticks. The information they give, it's like completely wrong. And you're like, oh, wait, if the news station could have just gone to your website or done a quick Google, but they just say some things, and you're like, the myths that are out there are just, it's so upsetting that like there is so much information, and yet there's still so much bad information getting out there. So our hope too is just trying to tell people there's really good information. Just make sure you're going to the websites that have that, not just, the local news is like, oh, just be careful. That's not extremely helpful. And the other, I think one of the biggest things, if you get bit by a tick, how to remove it properly. We posted, I think Dan Wolf from, he makes the tick tweezers. We posted one of his videos on our TikTok of how to remove a tick. It had over 1 million views in like 2 weeks. So people are looking for that information.
I think we put it on our Facebook page. I think we put it on our Facebook.
And we're like, people are needing this, and they're not knowing where to go. So that's where we're hoping we can help educate from all angles. But so I guess the other thing that potentially could make a difference in the coming years is the Lyme disease vaccine. So, or is it just now? It's in stage 3. Is it now just like a waiting game to see really what the results are from that? You have high hopes?
Well, I think that the Lyme community has a lot of mixed feelings about the Lyme vaccine, because the last time that there was a Lyme vaccine, it didn't turn out well. And so I think people would want something that was safe and effective. But who makes that decision?
Right. And there's a lot of different,
Determines
and vaccines have become a little bit more of a hot topic. And yes, so that's
right.
maybe
And then
changes.
also the thing about Lyme disease is that, as we said earlier about Lyme complex or whatever, is that there's all kinds of nasty stuff you can get from a tick.
Right.
And so it's, things that there are some things, in the development stages that would react, would protect you if there was any tick saliva that was inserted in your body.
Okay.
And that would, push out all of the bad stuff. So, because if something, even if it was safe and effective for Lyme disease per se, what brand of, what strain of Lyme disease, and also, what about all this other stuff?
Well, and that's, actually,
so,
yeah, there's so many other tick-borne disease. We do a lot with the alpha-gal community too. And there's,
right.
it's, with the Lone Star tick is, that's another, can be quite debilitating. But there's not so many people like you all and that the information they're getting out too. And they're seem to be in a similar, time frame of alpha-gal, and then also the diagnoses, and people, same thing. Okay, my stomach, I just had the stomach ache, and wow, I'd be making these connections. But now again, like, people are getting out there, and there's some doctors that are finding it, but I'm sure some of the people I've spoken to in that community, they just thought they had a bad stomach for, 20 years and had just digestive issues.
Well, and just, you didn't really explain what alpha-gal is, but it's that if somebody's bitten by a tick, the certain, Lone Star tick, and sometimes they develop this allergy to red meat.
Yep, exactly. Yeah.
And for some people, it's even things that are, sort of peripherally related to red meat. It's not eating stuff, it's being, around it.
Yeah, even the fumes can affect some people. Yeah, cooking.
Yeah. And so it's, and people, there are people that have alpha-gal and Lyme disease.
Right.
And, other kinds of things too. So it's just that whole realm of tick-borne, tick-borne diseases.
So it's the vaccine also doesn't, maybe there's other things. Even if there's a Lyme disease vaccine, there's still, so many other ticks are transmitting so many other diseases. So you don't want people then to say, oh, I got the Lyme disease vaccine. Who cares if a tick bites me?
Oh, I'm good.
Now, big worry.
Yeah. So it's problematic, but we're watching it with interest.
Yeah. Okay.
We're watching it with interest, but it's problematic.
Okay. All right. Well, I think I've taken up a lot of your time, but Lyme disease.org, really, we're so impressed with all that you all do, and so happy that we can partner, and hopefully, we can, to prevent people from getting bit by ticks and educating them too how to protect themselves. So, and I know you all, explain about permethrin, and I'm going to hopefully give some more information on a guest blog so people from your website can see, all the benefits about using the pre-treated product to, if someone in your family has Lyme disease, we don't want, the less amount of people are getting bit by ticks, the better for everyone. So hopefully together, Absolutely. It's all about education on all sides. So, we can do prevention and care and support. And, I think the more people are talking about it, the more, you have a friend and you tell a friend, and it gets out there. Because I think you're just an all good, but it was your neighbor who said to you, maybe your daughter has Lyme disease after going to however many doctors. So,
And I hear that from someone. I hear a variation of that from so many people. That one, I don't know exactly what it was now, but somebody that I knew, she said she was pumping gas at the gas station, and self-service. Right. And the next guy, and she said some expression of she was angry or
Okay.
something. And he said, well, why are you so upset? And she said, all these, my daughter's having all these problems and blah, blah, blah. And all the doctors say there's nothing wrong with you. And the guy said, look into Lyme disease. It was literally the guy at the next
Oh my gosh. I mean, that's where it's coming. The more and more people that at least know that can maybe say, hey, Lyme, just like unbelievable. And she had Lyme.
Yeah.
And
and she had Lyme disease
diagnosed by
and lots of other stuff.
Yes,
lots of other stuff. But it was like the mother was telling me about that later, and she said she'd gone to all these doctors that would no, that's they don't just say we can't find out what's wrong. They say there's nothing wrong.
That's a
mother of this
right
greatly suffering child, and they say, oh no, there's nothing wrong, nothing whatsoever wrong.
Heartbreaking.
And Merriam-Webster, the dictionary, chose the word of the year this year was gaslighting.
Yeah.
And that's a word that is used a lot in Lyme disease, people, support groups and everything. And it's gaslighting is what many of us experience, which is what I was just describing, where you're saying, my kid is suffering so much, and they say, oh, there's absolutely nothing wrong. And so anyway, I wrote a blog about that. I thought that was funny. That was the
that's
word
probably
of
a good
year.
yes.
Every year the dictionary chooses a word.
Right. Right.
But so
all right. Well, thank you. I'll let you. Yeah. So, thank you so much for your information, and hopefully we'll get more and more people knowing that. I mean, obviously, of course, if you Google Lyme disease, you get to your website, but just people knowing, and then can say to someone that maybe they know that hasn't been feeling great for a while or having these different symptoms, like this is something to look into. And it is all over the country, and it's not. I mean, I grew up in Maryland, but everyone still thinks of it as this like North, New England, and it's not. It's everywhere. So no matter where people are in the country,
and Canada,
and yes,
and Canada, a lot of it being recognized in Canada.
Yeah, no, it's really the more we will hopefully, less and less people get bit by ticks, and more testing and all the work you're doing will help generations to come. So okay, all right. Well, thank you so much, and I will be in touch, and I really appreciate your time, Dorothy. Thank you so much. Bye-bye.